Hey there, Lena and Bakari. That's right. We first got to backtrack to say that measles in this country was basically eradicated decades ago, and now it's making a resurgence. Dr. Kieran Moore saying back in the fall that this started during a Mennonite wedding in New Brunswick. One of the guests got infected, brought it back to their hometown in southwestern Ontario, just outside of London, and that's where the outbreak really started. And it has spread from there, and now we're seeing an outbreak in a situation where we didn't think we'd find ourselves in just a couple decades ago. But he did release a report saying that 6 babies, newborns, were born with measles. And that is due to their unvaccinated mothers. Luckily, they all recovered, but this could have been so much worse. There are complications that lead to being born with measles, including inflammation of the brain and death. And that is exactly what happened last Thursday. We understand a premature baby born with measles later died. Kieran Moore also mentioned in that situation, that baby had multiple other challenges when it was brought to this world. He also mentions that since the outbreak in the fall, 40 moms have contracted measles. 2 were vaccinated. And so here's what he had to say with CTV News about some precautions people need to take now in order to prevent not only them getting measles, but if they do eventually become pregnant, passing it down potentially to their kids.
It's a key measure and a key message that vaccination, which is safe, effective, is our means of preventing these types of harms in pregnancy. You should be vaccinated before getting pregnant. And in that way, it'll have the greatest benefit and effect. And you have to remember, it also provides protection against rubella. We haven't had congenital rubella cases in Canada in a very long time, but that is a risk, and that virus it causes significant harm to the unborn as well.
Now, he did mention, you should have been already vaccinated against measles. It's 2 shots. You probably should have gotten it when you turned 1 year old and a short time later after that. But if you still are unvaccinated and you are pregnant, you're living in an area that has active measles cases, Dr. Kieran Moore suggests that mom isolate and not be around those people potentially. You could take an IV immunoglobulin, which could help reduce the chances. However, as Dr. Kieran Moore has mentioned, there are certain people who might resist that the same way there are others who resist the vaccine. And he said a key here, Bakari and Lena, is to try to get to that population, that one in southwestern Ontario, to try to let them know the potential harms that they could be doing, not just to themselves, but to any unborn children later down the road. Back to you.
Right. Okay, joining us live from the newsroom, TV24's Phil Perkins. Phil, thank you.